And then we're going to assess the Prague classification. So first you assess the circumferential extent, and the Prague classification is always assessed while you are pulling back the endoscope orally. So it's a long segment Barrett's, and you can appreciate the stricture here at the top, which as such is not a risk factor for cancer, but obviously it indicates the degree of severity of inflammation that had been there before. And we needed to pass this a little bit, and we were just able to pass it with the imaging cap on top. So we do again now the white light overview, which we already did partially, and if you paid attention well enough at the top of this Barrett's, this becomes a little bit irregular, as you can see here. There is some friability, so if you see something that starts oozing, like here at 7 o'clock, this should draw your attention, and this deserves further interrogation with the other techniques. And you can also appreciate some nodularity. I'm not about you, Helmut, I don't know about you, but I would not really classify this already as a clear, visible lesion according to the Paris classification, but you can see that something something catches your eye there. So the second step then is to get an overview with the narrow band imaging. So we're switching now to the narrow band imaging. And then we come back again to the top of that Barrett's. And for some reason, I think we're biased. We already know that biopsies were taken showing no dysplasia. And I think the features we see here could definitely correspond to residual inflammation. And if we're now going to interrogate this, obviously this is a completely different pattern. The mucosal pattern has become irregular, as has the vascular pattern. So we see vessels that are actually crisscrossing the crypts. The crypts are irregular in shape and not everywhere the same. Here there's actually a loss of the crypts right here in the middle. If you go underwater.
Looks a little bit depressed.
Yeah.
And of course she had biopsies previously, so sometimes biopsies can influence our description and make it much more difficult to find out suspicious lesions. Wir benutzen jetzt ein neueres Gerät, das Lucera-System, ein Endozytoskop, mit dem wir bis zu 500-fach vergrößern können. Und dieses System hat jetzt den Vorteil, dass wir auf NBI schalten können und dann eben entsprechend vergrößern. Wir sind jetzt an dieser Stelle, die Herr Bischofs gerade gezeigt hat. Das ist ja die Stelle, die uns so ein bisschen Sorgen macht. Und wir werden dann noch mit Essigsäure anfärben und vielleicht mit Indigokamin. Und wenn wir jetzt mal da so ein bisschen reinzoomen mit dem Endozytoskop, ja, was sagt uns das? Das sagt uns erstmal, naja, wir sehen die Gefäße noch genauer, aber die Frage ist natürlich jetzt, ist das pathologisch oder nicht? Und weil wir subjektiv da uns oft so schwer tun, ist es vielleicht besser, dass wir in Zukunft hier Bilder quasi bekommen vom Computer.
Okay, so we're spraying here now a 2% acidic acid solution, a little bit harder. Yeah, I like to have the shower effect like this. Very good. So that goes very quickly, and you can see you have an instant whitening of the mucosa. And actually the area that we were looking at here does show early LAW, as they call it, or loss of acetyl whitening. So the early LAW sign is shown here. You can see the nice acetyl whitening here on the top, which shows you nicely the crypts. Obviously the vascular pattern is gone once you do that. And then here we have this area which stains red and stands out against the white background of the rest.
We